Thank you, Harry, for the invitation, and thank you for the work you are doing, John Bennett. It's tremendous work for us, for all of us, and it's really in favor of the neurosurgeon all over the world. I will not entirely speak in my brief introduction about only about the new study, but also about where we are in the world for neurosurgery. I represent the World Federation, who is about 49,000, let's say around 50,000 surgeons from 130 society all over the world. The main mission is to improve neurosurgical care through training and research. And you know that we all know what's going on. In 2015, the Lancet wrote a milestone paper about global surgery. Until 2015, all the money for countries in development, or let's say low and middle income countries, were targeted to communicable disease and many others, infective disease, HIV, all of these kind of issues, because they thought that surgery was extremely expensive and not fitting for developing these countries. After this paper, it was identified that something like 5 billion people all over the world are in need of proper surgery and cannot get it, which is even more than that about infective and transmissible disease. So neurosurgery, actually, it's in part, or even in one important part of these new surgical efforts. We have 4 listed surgeries within the competence of the new global surgery, which are basically surgery for trauma, and surgery, both brain and spine trauma, and surgery for hydrocephalus. So we are part of this global effort to improve surgery in countries with low and middle income. If we look at the paper published, you can see it here. The global neurosurgery was not there until 2016. Then, through the effort of many neurosurgeons like Key Park, Russo, and ourselves as well, the number of publications increased, and I am pleased to tell you that last year we had more than 25 publications targeted to global, what we call it, global neurosurgery. Where is the disparity? The disparity is here. You see, this is the number of available neurosurgeons all around the world. And you see that Southeast Asia and Africa are in lack of a good number of neurosurgeons. This is the ranking of the neurosurgeon per population. On the extreme right, here you see Japan. Here you have USA, Brazil, and all Europe is somewhere situated here, whereas the poorest country are there with very limited number of neurosurgeons available, as you see. But even more important, this is a very important paper. It is about children, but it concerns all of us. These are the available instruments to do surgery in different areas of the world. And you see that in low income and low middle income countries, there is very little available instruments here. And only one part of the world, the high income country, have almost everything. I would say almost, because apart from United States, even Europe has some problems in some part of our work, like epilepsy and cerebrovascular surgery. So apart from the number of neurosurgeons, the number of available instruments varies a lot among different parts. Basically, there are 2 parts of the world. Our part, which is called the Western part, where we do have to play with these beautiful new microscopes, the exoscopes, or whatever you want. And another part of the world, these are two colleagues who are operating in Africa for charity in Benin, and they are using the telephone as a microscope. This has also been published recently by our colleagues in India. The same, the use of telephone for magnification. So, or you see it here, we have beautiful tools like O-arm, intraoperative CT scan, anything, HIRO, anything to use, to be used in trajectory for pedicle screws, like here, or in some parts of the world, we need steel frames and wires. So the approach to the same operation is very different in different parts of the world. I just escaped this, which is too complicated, but I ask you to read this paper and to see how big is the world of neurosurgery. These are 13 million of neurosurgical operations per year that we are doing all around the world, and you will be surprised to see how important are traumatic brain injury and traumatic spinal cord injury and even stroke as compared to what we think it's a common way of operating, like epilepsy surgery or brain tumors and so. So just look at this paper to see how big is the world and how different is the world. Obviously, we need to improve this situation, but how can we do it? That's the issue. We are, as World Federation, we have founded a foundation who can support education of neurosurgeons all around the world. We have 3 programs. One is the full postgraduate training center, which means that the students, the doctors, can be trained for 5 years for the full period. Then we have what we call short period training center for 1 month to 6 months training all around the world. In Africa, we had quite a number of centers who can train African neurosurgeons in Africa with the help, economical help of the World Federation. And you see that together with many other centers and the efforts of many others programs and African neurosurgeons, the number of neurosurgeons was moved in sub-Saharan Africa from 1 to 8 million to 1 for 2 million in 2016, a 4 times increase in the number of neurosurgeons, which clearly are not enough yet, but they are improved. And another issue that we always forget is advocacy. We need the people to know about what we are doing. This is a paper published in Kenya about the first time where brain surgery was done in a peripheral hospital in Kenya. And this is a bridge between Bandung in Indonesia and New Guinea, where there is a new neurosurgical unit starting to operate. So we need to help our colleagues to start and work. So apart from that, we are organizing courses all around the world. This is an endoscopy course. These are 3D cinema lectures, very, very important new initiatives. This is a Congress on Neurotrauma where we have supported the participation of students from all over the world. This is a WFNS symposium in Kenya, and these are the educational and training course that we are doing. I just go through very quickly. You see it here in Togo and everywhere. Another way of education is the one we are having now, today. It's the use of the web for education, which is extremely important in countries where going to a meeting or going to a course is, from the economical point of view, difficult to achieve. So we have recently published a full review together with our colleagues of BrainBook, a full review of what the digital teaching can be helpful to low and middle income countries. And as you have seen here, there are quite a lot in the web of This is the one where we are now, the neurosurgical TV, but there are many others tools that we can use from the web to improve the education of our young neurosurgeons. And the webinars that we have done through the World Federation, and this webinar is today, and the webinars organized by the Asian Neurosurgery, like today, from many of you, including Hypecherian and many others who are Professor Kato, who is the mother of all these issues. And I think this is extremely important. This is a simulator for the phone that we have organized in Europe together with the European community, and is freely available for all of you for neurosurgical simple approaches. There is a weakness that we all have to know about internet learning. Internet learning has no quality control in some sites. Whenever we see a surgical procedure, we have to be aware that in the internet, there is no surgical approach curve. So remember that whenever you want to do a surgical approach, always remember a learning curve who is not there. And we need clearly a place where we have to display these kind of webinars and the web-based education approved. What we know is that, and I'm going to finish with my presentation, if we look at the numbers, for instance, of brain injury, we see that these are the most frequent brain injury in different countries. You see South America, Mexico, Africa, this part of Southeast Asia. These are the countries with more trauma, and these are the countries who are publishing about trauma. And you see that the world is reversed. What the part of the world who is publishing is the part of the world with less of this disease. And this is coming because from low and middle income countries, we only have something like 4.9% of everything is published. So less than 5% is published by a group of people, of countries, where we have about 40% of the world population. And if we look about what is published from these countries, you see that most is brain tumor. And brain tumor is not the top surgery that they are doing in terms of quantity. So it's also a reflection of what we want from them, and what is feasible to publish in our peer-reviewed papers. And these are the most publishing countries in the world, and you see that only India, who is low middle income countries, is among the first 15. So most of what is published is coming from United States, China, Japan, and Europe, most. And even more important, if we look at the most cited papers, so citation index, then we have a clear prevalence of the United States followed by Europe. So basically, if we look at the most cited papers, we have only two parts of the world, United States and Europe. What does it mean? That whenever we generate through evidence-based medicine guidelines for management of everything, this is the guidelines for high-income countries, you see that this evidence-based is generated only in one part of the world. So whenever we want to cure a patient in let's say in Sub-Saharan Africa, we have to cure it if we follow the guidelines according to guidelines who are generated in North America and Europe, where the situation is clearly, obviously, very much different. So the solutions are clearly, we have no intervention is possible without data. That's why IGNOS is so important. And no improvement is possible without the knowledge of the local facilities. And these are number of papers published by European and American universities together with African neurosurgeons. And you see that these one of these experience, the experience done in Uganda by the Benjamin Worth group, and the Uganda group reached the New England Journal of Medicine. So the global neurotrauma outcome study is extremely important in the way of getting education and in the way of getting data from all over the world and keeping us aware of what is the possibility to treat patients with traumatic injuries in so different countries. And as we have done recently with Peter Atkinson and other colleagues, another issue is involving colleagues from countries who have limited facility but a large number of trauma in our publications. And as you see, this example is a combination of Western university together with Colombia, Pakistan, India, Nigeria, and so on. So we need, basically, we need to work together. And just to finish, this is the bridge in Rome, one of the oldest bridges we have. It's a middle-aged bridge built up on a Roman bridge. And we need that on one side of the bridge are the Western countries, Europe, US, Australia, Japan, China, and everything. On that part of the bridge are the countries in need, and we need to connect them with all the possibility we have. This we are doing today is one possibility, like education via web. We have to invest resources, we have to collect data, we have to publish data, and we have to suggest intervention. That's my view. Thank you.
Thank you so much, Professor Franco. Any questions or comments from the panel? We have a very big panel today. We have with us Professor Ignatius Izzi. He is the chair of the Young African Society of Neurosurgeons. Could you please shed some light on Professor Franco's talk and your opinions about that?
Yeah, thank you so much. Actually, I'm not a professor yet.
Okay.
Hoping to be a professor soon. So actually, it was a very nice presentation for Professor Franco. And actually, I just finished my training in Cairo and the US, and then I returned to Cameroon. And what Professor Franco has been saying is what we are finding on the ground. For example, in Cameroon, we have about 20 neurosurgeons, and most of them are located within the major cities. So there's a problem of quantity, and then there's another problem of geographical distributions of the neurosurgeons. So even though they are few, the few that are available are only located in the urban centers. So you find all the rural areas having a lack of neurosurgeons. So this is a general trend which you will find across Africa. And the second point he raised was about the long-term that showed that there were just about 0.3% of the publications in the neurosurgery journal of neurosurgery and ACTA that were from Africa. So this also comes again to corroborate what he's saying, that even though most of the publications are coming from the developed countries, the guidelines are based on this evidence, and we have to apply them in the developing countries. So we in the developing countries actually need to step up in the publication, and that's actually what we are doing at the level of the Young African Neurosurgeons. That's why we also encourage most of the young neurosurgeons to participate in this study, especially the global neurotrauma outcome study. And we also encourage them in other many multi-center studies, because this is also going to help to provide data about Africa. And as you can notice, there's basically no data about Africa in most of the websites. So I'm sure in the next coming years, we are going to provide a lot of data for Africa.
Thank you.
Any other questions? Any comments from the panel?
Yes, I have a question.
Yes, Manuel, please. Can you please introduce yourself and then proceed? Yes.
My name is Manuel. I'm from Dominican Republic. Right now, I am in Moscow. I am resident of neurosurgery. Buon pomeriggio, professore.
Thank you, grazie.
Io sono andato a Napoli l'anno scorso, professor Capabianca.
Perfect. Thank you.
So my question is, for example, I came from Dominican Republic. We are now in Dominicana, they are like 60 or 70 neurosurgeon. But for example, almost maybe 50 of them, more than the 70% is in the capital, in Santo Domingo. There is like in the border with Haiti, we have 5 cities, and around that cities another ones, and they don't have neurosurgeons, nothing at all. So the people from the borders, I work in the border 1 year. The people from the border with head trauma, and if they need to see a neurosurgeon, they need to go 300 kilometers for the public neurosurgeon, because in the private they can get, but still it's like 200 kilometers in another cities. And in a very few hospitals in my country, they don't have like even microscope, for example, and don't even talk about endoscope. So what the World Federation of Neurosurgical Society can do from that kind of country, for example, because we are poor country and very few neurosurgeons.
Well, this is an issue that if you go to the website of the World Federation and you click over a country now, since I think 1 year, we are working on accessibility, meaning which part of the population of that country has access to neurosurgery within an hour, which is important because, as you said, in many countries in the world, even in many countries with low and middle income, the number of neurosurgeons may be enough, but they all are in the same area. There are no neurosurgeons outside this area. And this is a problem which can be solved only, I think, through education in the country. There are countries who are putting now efforts to, let's say, when the educated neurosurgeon, the young one, come back, they are almost obliged to go for 3 years in rural areas and not to stay in the central areas. In China, I know that now in many areas of China, it's almost mandatory that you have to pass 2-3 years over there. But this is something that is difficult because if you want to send someone there, you need instrument, as you say, you need microscope. You cannot send the people to operate without anything. It's a complex issue. We are starting to work on that. And if you click, for instance, on Repubblica Dominicana on our website, I have done it now, you have a map with colors which tell you where are the neurosurgeons and which are the areas where we don't have neurosurgeons. This is something to start with, to know how is it in single countries, and then intervene. But it's difficult. I agree with you. This is another issue. In some countries, we don't have enough neurosurgeons. In some countries, we have, but they are all in the same area. You're right.
For example, in my personal experience in 2004, I remember a friend of my family, he had a head trauma in a motorcycle. And he was in a city called San Juan, and he need to go to the capital because there is no neurosurgery in all that area. And of course, unfortunately, he died because it was like 200 kilometers.
Well, we need to involve the politicians to understand that we need the neurosurgery spread all over the country, not concentrated. But remember, it's not only a problem of politicians. Sometimes the neurosurgeons like to be where is the money, I tell you clearly.
Yeah, no, yes.
In the capital, they want to work there. We can understand it. So we have to find a system that the youngest one will pass part of their education and stay in remote areas. That's the only way, in my opinion.
Thank you so much, Professor.
Thank you. Any more questions, comments? Professor Cherian, would you like to add some comments to Professor Franco's talk?
Yes, I have comment about Professor Franco.
Yeah, please introduce yourself.
Yes, hello, good morning, everybody. I am Nuruddin Adenera Bankole.
Yeah, I
am
can
resident.
Yes.
I am a resident in WFNS center, reference center in Rabat, in Morocco. I'm so glad to meet you again, Professor Franco Servadei. I meet you last time in Marrakesh.
Okay,
Last
correct.
time,
I
and
remember.
it's pleasure to meet you. Yes, it's very nice to it's very nice to meet you again today, and I would really I would want to thank you for all you've done for young neurosurgeon in Africa. We know now since many years that you've done big effort to keep up and to keep up African young neurosurgeon and to help us to going together further. And I would like to thank you very much. And uh, we young neurosurgeon we have now now our I don't know how I can explain that, but we know that we have one challenge today, and this challenge is to be strong between us in Africa and save life about our population and do all our best to treat in our country all pathology about neurosurgery like vascular pathology, tumoral pathology, pediatric neurosurgery, all these pathology. Uh, we know that today we have to fix this challenge to treat our own population in our country. To not need to done to done transport or transfer to another country. So we we are working together to attend and to achieve this goal, and we know now we can trust on you, and you are really here to help us, and I would like to say really thanks you, and we are on the same way. Thank you very much, Professor Franco.
No, thank you for working with us. I have to thank you. Thank you very much. We see us soon in Tanger.
Yes, I know, in June.
Yes, yes, correct.
You are welcome, Professor. Welcome.
Thank you so much. We'll just take one more question and then we'll move on to the next. We have Dr. Ulrich with us. He is also from Africa and he has some few points to raise. Please go ahead.
Thank you. Ulrich Sidney, a final year medical student and future research associate at Harvard. Thanks for your presentation, Professor. Just a few comments about the lack of research from low and middle income countries. I would like to suggest that there should be more programs from the WFNS, the Young African Neurosurgeons, to help students to participate as well. Because I believe the earlier we get immersed into research, the better it will be. Then the second thing is usually African researchers and neurosurgeons don't have access to the same kind of funds that their high-income country counterparts will have access to. So that's another issue we need to address. And the publishers, usually they accept fancy granular research, whereas in Africa, we're still for most of our research at very basic kind of research. So when a neurosurgeon comes up with an article, usually he doesn't have the ease to publish into, say, ACTA or neurosurgery and all the other big reviews. And then finally, I'd like to congratulate the initiative from WFNS, but particularly from the Young African Neurosurgeons via Dr. Estene Ignatius. Thank you very much.
Yeah, well, just to give you a last comment, you're right. I mean, you're right in many. We need to have a share of fundings, and we need to understand that if we want, I give you an example, if we want to publish guidelines, we cannot go ahead like we have done now. We have to invest some money to involve our colleagues from Africa and East Asia to work with us. And investing the money that we are investing for the process of evidence-based would be enough to have some of you working with us. We need to work together. We cannot separate the world into two parts. That's you are right. We need, the funding is an issue. Thank you.